Hello and welcome to the Headache Doctor podcast. We're on this podcast. It's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I am so sorry that I sound like this. I am recovering from being sick, and it's actually kind of appropriate because we're going to talk about smoking and nicotine use as it relates to headaches and migraines. So I have Dr. Thomas here again with me on the podcast. Thanks so much for being on the podcast, Dr. Thomas.
Happy to be here. And yeah, we've been joking about it all morning that if you're going to sound hoarse for one podcast, this is the one to do it.
Yeah, so suffer through this with me. Thank you, listeners, for tuning in every week. Now, if you're new to this podcast and you're trying to understand, okay, how do I navigate this? Use it like a library. So go through, look at the topics, find topics that relate to your personal story, maybe find your diagnosis if we've talked about it, that sort of thing. But look through the archives. There's over 240 of them now. I've been doing this for several years, and welcome to the Headache Doctor podcast as we're on this journey, like I said, to educate and empower everyone with headaches and migraines. And so today we're going to talk about nicotine usage, and I'm going to let Dr. Thomas do most of the talking. And so what do you got for us today?
Yeah, so this kind of came out of a really interesting question we were debating. So we're obviously based in Colorado, and many people are pretty well aware that cannabis usage is actually quite common in Colorado. And so we have every so often someone asks me as a patient, what about cannabis? What about this? The other one that comes up fairly often is people complain about, the kids are all vaping these days. And it led to a really interesting discussion on the effects of both nicotine, so smoking, vaping, and then cannabis use on headaches. And it was something, again, as a provider, I've kind of struggled to answer because it's like, well, maybe I've seen a little bit here and there. And, of course, smoking is bad for you. But we actually wanted to dive into the research a little bit today. And so spoiler alert, smoking and vaping are bad for you. And then we'll talk a little bit more. Cannabis is a bit more nuanced, but we're going to talk about all three of those today and their effects on headache. So we'll jump right into smoking first. Smoking, again, this is probably going to be the least surprising, but smoking is not good for your headache. We tend to find that any use with nicotine, so this can be vaping, this can be cigars, e-cigarettes, gum, lozenges, any really foam or form of nicotine usage is tied with headache. Specifically, it's tied with a number of headaches being more common. So, for example, you are more likely to suffer from migraines, trigeminal neuralgia, tension headache, and cluster headache if you're using nicotine. And I wanted Dr. Taves, especially cluster headache, has a good amount of research. So before I go into that, I just wanted Dr. Taves to talk about cluster headaches and how fun those are. If you can remind everyone what those are.
Yeah, so cluster headaches are some of the most debilitating types of headaches. Oftentimes cluster headaches can be accompanied with like teariness or eye redness, swelling around the eye, and it can be a really intense pain. There's oftentimes this cyclical pattern to it where it'll hit and be very debilitating, and then it can be absent for a period of time. So they come in clusters and then they're sort of absent. And these periods of no headache can be, months and months, maybe a year or more. But when they hit, very debilitating. And oftentimes they're one of the types of headaches that can respond well to like oxygen. And I think the body's just under a heavy amount of stress. So anything to like ease the amount of stress due to the type of pain. But typically it's a pain located behind the eye, maybe in the forehead or the temple. It's very intense, and it's debilitating while it lasts. I think they've coined it suicide headaches because of how debilitating the pain is, and so it's rough. And so if there's anything that contributes to that type of scenario, we'd want to avoid it.
Yeah, and nicotine really is, like I said, there's a good amount of research on cluster headaches, and your use of nicotine, it is interesting. Your cluster headaches will tend to come on later in life, which I thought was kind of a different one. But once you are using nicotine and you do suffer from cluster headaches, you're more likely to have more frequent attacks. they're more likely to be chronic. So sometimes our people will just have, oh, hey, I had one time this happened. If you're using nicotine, it's more likely to be a chronic use type of a thing. Your attacks are also more likely to be more severe and to cause more disability at home. So cluster headaches especially are really quite tied with nicotine use. And again, if you're already calling it a suicide headache just with the normal one, you can imagine how much worse that is with nicotine. So all of those, again, and migraine attacks specifically, this is a little bit more controversial in the research, but you can end up with a kind of triggering a migraine attack due to nicotine usage. Like I said, a little bit more iffy on that one it seems the research goes back and forth, but they have found a connection between smoking more than 5 cigarettes a day and then having a migraine attack. So definitely some really negative side effects with nicotine use and smoking on headaches. Now, the mechanism is pretty unclear as to what causes headaches. So there are a lot of toxic chemicals within a cigarette. One potential kind of suspect is cadmium. Cadmium, I believe, is a heavy metal, if I'm remembering it, at least as a metallic substance, quite toxic to the brain. And so if you're smoking, that can be one cause potentially of your headaches. The rest relate to nicotine. Nicotine does some interesting things with the brain. So one thing it does is it sensitizes the nerves. So if you're having headaches, whether or not they were triggered by the smoking, it may make it that your nerves are more sensitive and you're less likely to respond to like pain medications. So that's one area. Nicotine can also cause vasoconstriction. So getting less blood flow to the brain, less nutrients, you're more likely to suffer from a headache. You can also suffer from just kind of a smell triggered headache. Smells are, quite a migraine trigger sometimes. And we all know smoking is a pretty strong smell. So all of those can be potential causes of why nicotine is causing headaches.
Yeah, that's interesting because when we think about the framework that we use to understand someone's situation and simplify all the noise of like what's out there as far as avoid triggers, take this medication, my migraines are hormonal related, mine are related to diet, whatever it may be. If you see a connection in nicotine, if we're looking at sensitizing nerves and reducing thresholds for pain, that falls well into the category in our model that looks at the systemic side of someone's health, so someone's overall health. And if there's something like imbalance of hormones, inflammatory foods, or that could even be toxins in their environment that make it harder for their body to really tolerate the pain signal. Those are things that, can dramatically impact their ability to tolerate pain, making them sort of in a chronic state of being vulnerable to this migraine situation. And then, vasoconstriction. We know that during a migraine, the serotonin and the impact on blood vessels that feed the brain becomes sensitive. And so the sensitization, oftentimes medications are utilized in order to change the amount of pressure that's being placed on the blood vessels. So if we have something that's doing the opposite effect, obviously that's going to negate the impact of medication. Not that medication is what we want to be taking, but if it's having a negative impact on those blood vessels anyways, whether you're taking medication or not, and those blood vessels are already sensitive because there's pain, there's this intense pain signal coming from the neck, your brain kind of is sensitive to just about anything. So we don't want something impacting the blood vessels in a way that would make it more likely for you to experience a migraine. So those are right in line with what we talk about and in a very clear, like, hey, let's avoid this.
Oh, yeah. And it's not just you smoking yourself. So even if you're listening to this and you're like, oh, great, I never smoke, this can actually also come from secondhand smoke as well. You're still breathing in chemicals when you're dealing with secondhand smoke. You can also have an allergy to the fumes, and you also just can be sensitive to the smell. Like, we're going to talk about smell quite a bit today. Obviously, these are substances that smell quite strongly one way or the other. And so even if you're just in a household with someone, or say you've got a coworker that smokes a lot, even their smoking can be quite kind of negative toward your headache. So that's smoking in and of itself. And again, no real positives on that one. And I think that's pretty well understood. So I'm ready to move on to vaping if you're ready.
Yeah, let's do it.
Okay, so vaping, I put in its own category. So again, we mentioned just a minute ago that any form of nicotine use, you're going to be subject to all of this. So with the vaping or e-cigarettes, you can kind of say it either way. There's not necessarily a lot of different science with that. It's the same as we just talked about, all the sensitization, the vasoconstriction, etc., because you're still using a nicotine product. But I wanted to talk about this one specifically because it has been a bigger problem, especially with our youth. So 2024 statistics stated that about 1.63 million students, I believe this was just within the US, students, so again, young kids, this is high school and below, are vaping or using e-cigarettes. And that was about 3.5% of middle schoolers and 7.8% of high schoolers. So almost 1 in 10 high schoolers are vaping. And they've said that almost, I think, let me check my stats. 1 moment. A little over 60% of those did want to quit within kind of, they wanted to quit or they were trying to quit. And it is more heavily used between women over men. And so anyone that's listened to our podcast knows that women tend to suffer from migraines, I believe, about 2 or 3 times more than men. So you're already putting yourself at a pretty high risk when you're vaping as a high school student.
You're saying that high school girls
are vaping
more than the boys?
Yep.
Oh, interesting.
Yeah.
And 1 in 10.
Almost 1 in 10. So 7.8%. So almost 1 in 10. It's a very common problem. The health effects of vaping are not well understood at this point. It's one of those where it's kind of a fairly new thing and we're still learning about its side effects, but they have found that most products are going to contain nicotine, even the ones, this was an interesting fact, but they said even the ones that claim to be nicotine free, a lot of times do carry nicotine or have it. And there isn't a lot of regulation on like the packaging and what they're supposed to disclose as far as ingredients. So even if you're using nicotine-free vape, it still probably has nicotine in it. I believe one study found about 99% of the products found within the U.S. do tend to carry nicotine. So again, same problems as the smoking with that nicotine.
Yeah, it's probably like non-alcoholic beer. Like it still has a trace level of alcohol. Like it's hard to totally remove the nicotine component. Mm-hmm. Yeah, that's great insight. What else we got?
Yeah, so again, same effects with nicotine. You also have a side effect of just because you're breathing this in and smoking it, you can cause dehydration, which we know pretty well in Colorado can cause headaches. And then we come to, again, I mentioned at the start, we're going to talk about smell a lot today. So vape is kind of unusual in this field in that one of kind of its key characteristics is that it comes in a lot of flavors. And I kind of wanted to do a little weird example with this. So I'm going to put a little disclaimer here. If you are someone that's really triggered by smells, you probably want to skip ahead like 1 minute. But what I did is I actually went through a bit of an internet dive, just looking at some different vaping sites. Obviously, I'm not going to vape. I'm 8 months pregnant, but I wanted to read some of these flavors off to you. And I just want you, if you're in a place you can stop and think about this, I want you to just imagine inhaling some of these scents over and over and over into your body. So without further ado, some of our more interesting vape flavors on the market are Crazy Melon, Dragon Straw Nana, Fruity Pebs, that's Pebs with a Z, not Pebbles, Gummy Bear, Butter, Tuna, Crab Legs, Bacon, Pizza, Doritos, and Curry. And so if you're someone that is a little bit more on the nauseous side, you just sit here and imagine breathing in Doritos in and out all day, and you tell me how that would make you feel. I think that would trigger any sort of a headache for me, even if I wasn't sensitive to migraines. So again, these are not great substances to be using and quite migraine and headache inducing as well.
Yeah. I'm some of those I'm like, I don't even know what that would smell like.
Crazy Melon and I think Dragon Straw Nana I decided was
Dragon
probably
Straw Nana.
Banana, strawberry, and dragon fruit. That was my best guess.
Oh, that's pretty good. Yeah. I still don't know what that would smell like. But
I know. That one might smell pretty good, but butter's the one that I'm like, nope.
Yeah, or curry.
Or tuna. Actually, tuna's probably my worst one.
Yeah. I wonder how well that sells. Anyway.
I think they're more novelty. I think most people probably don't use the really super crazy flavors, but just to give you an idea, even if you're using them yourself or even someone around you is using them, like I said, that would probably give me a migraine if I smelled tuna for more than 5 minutes.
Yeah. We try to keep the clinic, Novera, our center here, we try to keep it like kind of neutral of smells just because we don't know what's going to be, what someone's going to be sensitive to or be triggering. And especially like the smell of smoke. I could imagine a lot of our patients probably self-select. Like they're like, oh yeah, I'm not going to smoke because I can't tolerate the smell of it. But I wonder if there's this dynamic of if you're already smoking nicotine, you start developing headaches, you're addicted to it, that sort of thing. But yeah, I could definitely see how those would be triggering.
Yeah, like I said, I found a lot of that kind of disgusting in general. So that's vaping. So again, vaping and smoking, there's not really any debate about those. You can't really make an argument like, oh yeah, this is good for headaches in any capacity. They're just not. Whether it's the smell, an allergy, all the nicotine side effects, there's really no benefit to using those products. So the last one we're going to move on to is cannabis, and this one is a little more nuanced. So I do want to put a disclaimer out there really quick. We are not advocating one way or the other for the use of cannabis. We're a health-based podcast, but we are just a podcast. So if you are interested in using cannabis, please speak to your doctor, do your own research. Don't really take what we're about to say as giving it one way or the other. Cannabis does have some pain relieving properties. So this is the only one we're going to talk about today that does have some pros associated with it. Cannabis usage can be found to reduce headache and migraine pain by about 50%. Men tend to respond to it better than women, which I thought was kind of interesting. And it is more useful in sort of a consumed form rather than a smoked form. I am oversimplifying quite a bit here, but essentially a product that you consume like an oil or sort of a concentrate tends to be a little bit more effective than just smoking it. So that's all we're really going to talk about with the pros, but just know that a lot of people do use cannabis for pain relief and you can get some pretty good benefit about it. I'm going to let Dr. Taves comment on sort of the idea behind cannabis and medication before we go any further.
Yeah, so we talked about this before the podcast, and our philosophy on treatment is looking at our bodies, how they were designed, and then restoring proper function, whether that's physically or systemically, looking at barriers of how we've developed and then overcoming those barriers, maybe physical barriers, things like that. So cannabis doesn't really work into that philosophy necessarily. So there are things that naturally occur in our bodies that maybe we need supplements for, and that's something we leave to maybe like a functional medicine doctor or a provider that's trained in knowing how to prescribe supplements, things like that. And we've had several of those on the podcast. Cannabis is not something that's ever come up in the interviews we've had with other providers. And so as far as its relief that you mentioned, what I would put that in the category maybe similar to a medication, where this is a substance that should be controlled, that should be guided by a provider that knows the risks involved and for your specific situation. And then it should, if needed, and if going that route, it should be viewed through the lens of medication. So here at Novera, we've actually never, or very rarely, if ever, had to recommend someone go receive medication that they hadn't already tried. And so cannabis falls under that category where we're not recommending like, hey, there's some relief with this, go try it, because it's not necessarily something that we would naturally need or naturally find ourselves doing. So we know that the body needs to move. We know that the body maybe has developmentally been impacted in a way where we can't move the way we should. So we want to understand those things, and we want to understand our overall health and how we can improve that through diet and exercise and balancing hormones, things like that, proper sleep. And so cannabis would fall under like the medication category, where we're sort of we're entering something into our system that wouldn't necessarily be a part of it. And even if we're not really getting many side effects, we want to get to those more holistic treatment approaches in order to solve the underlying problem, as opposed to just relying on something like cannabis. So there's my 2 cents with cannabis.
Yeah, and just like any medication, cannabis does have some side effects as well. So it's not just, use it without side effects, which I think sometimes is how it gets portrayed in media as, oh, this is so much better than opioids. And I'm not commenting on which one is better, but I can say that this does not come without some side effects. So one is tolerance. You are pretty likely to develop a tolerance to cannabis as you use it more and more. You can alleviate this if you really start slow and build up. And if you consume it again rather than smoke it, you can help alleviate this. But it is a substance that is associated with developing a tolerance, which means more and more is needed to get the same effect over time. So that's one. Marijuana or cannabis usage can be tied with headaches as well. This can be due to, say, dehydration. Again, we're talking about if you're smoking something, very easy to get dehydrated. If you happen to acquire a product that's not very clean, not going to comment on where you might get that, but if your leaves are moldy, say, which I thought was disgusting to think about inhaling mold, but you can trigger a headache pretty easily from a poor quality product. And the last thing is rebound headaches. So the research is a tiny bit mixed on this. There was a 2020 study that found that cannabis usage was not associated with rebound headaches, but then a 2021 study came out a year later and found pretty significant rebound headache effects. So it found that you were about 6 times more likely to suffer from rebound or medication overuse headaches due to cannabis usage. So again, the cannabis is not entirely without some pros, but there are pretty significant cons with this one that need to be addressed as well.
Yeah, whenever we have someone start our process, we try to get them off of medications as quickly as possible because it really confuses, and we want to have a lens into like, what are you actually feeling and where is the pain coming from? And so any type of medication, and cannabis included, that masks that and then increases your risk for a rebound headache, that makes our job a lot harder. And it makes it a lot more challenging for you to find the relief you're looking for. And so, yeah, in general, yeah, if there's some sort of short-term relief, it should be short-term. We should have a plan in place to not rely on these types of things, even though we could find some relief through them.
And that was going to be my last section. So anyone that's listened to my last couple of podcasts knows I like to end on kind of a productive note. I don't just like to present this and be like, well, if you're smoking, that's just the end. I always like to give people some sort of takeaways from this. So if you are using any sort of nicotine product, there's really, all I can say is don't start. If you can avoid starting, just don't start. Don't get addicted. Don't use it. Don't go down that route. If you are already using the product, it's time to stop. It's kind of like stomach sleeping when I work with my patients. It's time to be done. There's really nothing else I can say. And I will say that that's not necessarily the end. Sometimes cluster headaches don't go away even after you stop using nicotine. You can also get some pretty significant headache from withdrawal that can take about 2 to 3 weeks to resolve. So you do want, just for your general health, to stop using nicotine products. Just be aware, it's still probably going to be a bit of a journey. As far as cannabis usage goes, again, not advocating one way or the other for usage, but if you are determined to use it, just make sure you're staying well hydrated, make sure you're getting your quality product from somewhere, make sure you're consulting with a doctor. Just try and be responsible with this usage, and very much be aware that there are some pretty significant side effects with headaches as well with both of those. So
yeah, thank you, Dr. Thomas. I think that's clear, and I think it fits in with our mission, and especially here in Colorado, that's helpful information. I think it's something that we're gonna definitely raise sort of our awareness of here as providers, especially after this research that you've done and understanding the impacts of both cannabis and nicotine on someone's health and their headache journey, especially the connection with cluster headaches, because those are just debilitating. There's a lot of people that listen to this podcast that are able to take action, and then they see changes in their own health that they haven't seen, seeing providers, taking medication, like being on this journey for a long time. And so we truly do want to educate and empower everyone who's suffering with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. Dr. Thomas, anything else for us today?
No, the only, I guess, 2 things really fast. One is just thank you for listening. I'm going to be off on maternity leave for a few months, so maybe a bit until you hear from me, but I should be back in the fall. And then the only other thing I was going to say is just don't breathe in tuna. That sounds disgusting.
Well, thanks so much for being on the podcast. And for all you listeners out there, subscribe to the podcast. That way every week you get the notification that a new podcast is showing up. I am very committed to this podcast, as you can tell. My voice, I apologize again that I sound very hoarse. This is not normally what you'll be listening to. So don't count that against the quality of the content that you just received. Thank you all so much for being listeners, subscribing, sharing, writing a review, and we'll see you next week.